Yeah. Hi everyone. I'm back with another new video, and this is gonna be pretty interesting. Any guesses? It's gonna be eclampsia. Okay. So this is like a very broad topic. You can go hours on actually talking about this. Okay. So there is a lot. There's a lot to know about this. Because it is more likely in uh, a very highly tested topic, another highly tested topic. So, um, I'm gonna go talk on this one in terms of CCS again. I always like to stress this because we don't want to talk overbroad or go talking about some other topic. Okay, so the very first topic is preeclampsia. Okay. Now, preeclampsia can turn into eclampsia. Of course, the name suggests. So, first of all, let's know what is preeclampsia. Okay. So, anytime if you have hypertension before 20 weeks, it's gonna be preeclampsia. It's gonna be like a hypertension patient, okay? So, but in preeclampsia, you're gonna get the blood pressure raised after 20 weeks. The blood pressure is very high. It goes to up to 160. There can be alarming symptoms, meaning very severe complications. Just remember help. This is a very great mnemonic to begin with. Elevated liver enzymes, low platelet count, hemolysis, and P stands for preeclampsia, I guess. So this is a very great mnemonic. You can do CBC, liver enzymes, serum creatinine. So if the serum creatinine is above 1.1, that means it's alarming. If the patient presents with blurry vision, of course, it's alarming. So in that case, we need to hurry up and give certain important things to the patient. First of all, give magnesium sulfate because we don't want the patient seizing in ep- multiple episodes. What happens if the patient throws into a seizure? The baby is going to go into complications. There is fetal hypoxia, and this can happen at a very faster pace. So, first step is to give the patient a magnesium sulfate. Now, depending on the gestational age, it is important to begin certain tests. In the fetus, you're going to make sure if the fetus is fine or not with a fetal Doppler. You can do anything and that sort of things. But always remember to do EKG in a patient with preeclampsia because we always want to make sure if there is any rhythm beats. We want to capture abnormal rhythm and so on. So this is something very important. You need to do EKG in the mom as well. Okay, so this is one, and this is two. And then set the patient up for surgery. You can do pre-op orders. Okay, have the patient pre-op orders done way ahead because we never know when the patient is gonna go into labor. So this can be PT, PTT, INR, and then blood grouping, cross matching, the RH typing is also something very important in relation to this case. Okay, afterwards, all we're going to do is prepare the fetus. Okay, so if the patient's gestation age is less than 33 weeks, there is something that is very important. The most important step is to give the mom corticosteroids. Okay, because this is going to enhance the surfactant production in the baby. This is our right time to go ahead with steroids. Okay, steroids are very important. And then we can do vaginal delivery if the patient has severe symptoms. You should be going to C-section only if the patient develops alarming symptoms, meaning the patient did not have adequate pushes or did not have cervical dilation, or maybe the baby is in the breech position, or maybe she is exhausted in that situation. In ideal scenarios, C-section is not preferred here in US. We most likely want to do vaginal delivery. Okay, so prepare the patient and get the patient to vaginal delivery as early as possible, especially when there are severe symptoms. While on the other side, if there are no severe symptoms and the patient just comes in with hypertension, then you can just treat conservatively, avoiding surgery for up to 37 weeks gestation. Now, in terms of blood pressure, what are all the drugs that you might want to remember? This is pregnant moms love nifedipine. Isn't this so cool to remember? I feel it's very easy. So when you memorize this mnemonic, you can literally cram this into a very great score. So it is pregnant moms love nifedipine. So let me break it down. It is methyldopa, labetalol, hydralazine, and nifedipine. So all this can be given IV with oral nifedipine. Okay, this should be good enough for you to have the CCS going smooth in terms of preeclampsia. If you have any further doubts, please leave in the comment section, and I would be happy as usual to do so, to read and comment. Okay, comment on your comments. It could be great. Next, any other topics if you would like me to discuss, do let me know that as well. All right, happy study.